It's going to be a fixed number of dollars. You're going to have to convince specialists to give up some of their money to the primary care doctors. No?
You are in the model that you have been forced to be in, which is that somehow in order for one kind of doctor to make more money, other kinds of doctors have to make less money. And that is this notion that somehow there is some fixed budget for doctors and that the doctors have to fight amongst themselves as to how much they get. Most of the money is going someplace else, and most of the money is going to hospitals. And if both, back on the example I gave earlier, if the primary care physicians and specialists actually work together to be able to manage the patients better, they can both make equal or better money than they are making today because they're taken out of hospitals. They're taken out of device manufacturers. They're taken out of other sources of money. Now, this is a challenge for hospitals. And you have to be thinking about hospitals have to recognize that they are going to be smaller. But we have to help them transition too, because they've got a huge amount of money invested in fixed costs. So this is going to be a community discussion. How do you help hospitals get a glide path to a leaner, more efficient structure? But who's actually going to lead that? Is it hospitals that are going to lead that, or is it doctors that are going to lead that? Which is why doctors have to be taking the lead, because it's the doctors who can say, you don't need to be in the hospital, and I can get paid some more to be able to help you stay out. It's the biggest upside for primary care physicians. And again, I think it's why it's going to be a transition over time, because it's not going to change overnight. You know, it takes time to become a primary care physician. And we need to change the incentives and say this is a better, more attractive model. I think the most positive result that came out of the group health medical home demonstration project in the state of Washington wasn't that it saved money and it wasn't that it was better for the patients. The thing that I think a lot of people really focused on was that several of the primary care physicians who were planning to retire decided not to, because they said this is finally the way medicine is now becoming fun, and this is what I actually trained for. So the different payment model is not just paying more. I think it also provides a much more attractive environment in which for physicians to practice.